Did you know that diabetes can permanently damage your eyesight even before you notice any vision problems? Many diabetic patients believe that if they can see clearly, their eyes must be healthy. Unfortunately, that is not always true. Diabetes is one of the leading causes of preventable blindness worldwide. The most dangerous part is that diabetic eye disease often develops silently without causing pain or early warning symptoms. By the time vision becomes blurred, distorted, or dark spots appear, significant damage may have already occurred inside the retina. Diabetes can affect nearly every part of the eye. It can cause diabetic retinopathy, diabetic macular edema, cataract, glaucoma, and in severe cases, permanent blindness. Recent concerns have also been raised about rare optic nerve complications associated with medications such as Ozempic and similar weight loss injections. This makes baseline optic nerve evaluation even more important in selected patients. The good news is that most diabetes-related vision loss can be prevented through regular eye examinations and timely treatment. Every person with type 2 diabetes should undergo a comprehensive dilated eye examination at the time of diagnosis. People with type 1 diabetes should begin regular eye screening soon after the recommended duration of disease. A complete diabetic eye evaluation may include retinal photography, OCT scanning, optic nerve assessment, and computerized visual field testing. These tools help detect damage long before your vision is even affected. In this video, we will learn how diabetes affects the eyes, the warning signs to watch for, and the importance of a healthy diabetic diet. Join us as we take the steps necessary to protect your vision for life. Most people think diabetes affects only the retina. In reality, diabetes can damage the eye in 4 major ways. Diabetic retinopathy damages the retinal blood vessels. Optic neuropathy damages the optic nerve due to reduced blood supply. Glaucoma damages the optic nerve due to increased eye pressure. Cataract causes clouding of the natural lens and often occurs earlier in diabetic patients. That is why a complete diabetic eye examination evaluates not only the retina, but also the optic nerve, eye pressure, and lens. For patients with type 2 diabetes, a comprehensive eye examination should be performed at the time diabetes is diagnosed. For patients with type 1 diabetes, a comprehensive eye examination is generally recommended within 5 years after diagnosis. A baseline eye examination documents the health of the retina, macula, optic nerve, eye pressure, and lens. Diabetic retinopathy occurs when tiny retinal blood vessels become weak and leaky. This may lead to microaneurysms, hemorrhages, retinal swelling, abnormal new blood vessels, vitreous hemorrhage, and retinal detachment. The risk increases with duration of diabetes and poor diabetic control. Even patients with well-controlled diabetes can develop diabetic retinopathy and therefore require regular screening. Early detection is key. Protect your vision with a comprehensive diabetic eye screening today. A diabetic eye examination is usually simple and painless. It may include vision testing, refraction, slit lamp examination, eye pressure measurement, dilated retinal examination, and fundus photography. Dilating eye drops enlarge the pupil and allow the retina to be examined thoroughly. The doctor looks for retinal bleeding, microaneurysms, exudates, macular edema, new blood vessels, and retinal detachment. Additional investigations may be advised. Optical coherence tomography, or OCT, provides detailed cross-sectional images of the retina and helps detect diabetic macular edema. Fundus photography documents retinal changes and helps compare progression over time. Fundus Fluorescein Angiography is a special dye test that helps identify leakage, blockage, and abnormal blood vessels. Many people are unaware that diabetes can also damage the optic nerve. Reduced blood supply to this nerve may result in diabetic optic neuropathy, causing permanent loss of vision. Recent studies have raised concerns regarding Ozempic and a condition called NAION. These findings highlight the importance of documenting optic nerve health at baseline. OCT Optic Nerve Analysis measures nerve fiber thickness. RNFL analysis evaluates retinal nerve fiber health. Ganglion cell analysis detects early nerve damage. Computerized visual field testing identifies blind spots before patients notice symptoms. Together, these tests create a baseline record that helps detect future optic nerve damage. Diabetes increases the risk of glaucoma. Glaucoma damages the optic nerve slowly and silently. Regular eye pressure measurement, OCT nerve scans, and visual field testing help detect glaucoma early. Diabetes can accelerate cataract formation. Vision loss caused purely by cataract can usually be restored through modern cataract surgery. Many diabetic eye changes are painless. Blurred vision, floaters, flashes, sudden vision loss, eye pain, redness, or curtain-like shadow over vision require urgent attention. If detected early, diabetic eye disease can often be treated successfully. Treatment options include anti-VEGF injections, retinal laser treatment, steroid injections, and vitreoretinal surgery. Treatment works best when disease is detected early. Protect your vision today for a clearer tomorrow. Schedule your baseline screening now. Many people think diabetic eye disease is only an eye problem. In reality, it begins with blood sugar control. Every episode of high blood sugar damages tiny blood vessels supplying the retina, optic nerve, kidneys, and heart. Patients should reduce excess sugar, sugary drinks, deep-fried foods, excess salt, refined flour products, and processed foods. Maintaining a healthy body weight is extremely important because obesity is one of the major contributors to type 2 diabetes. Foods traditionally recommended for better diabetic control include bitter gourd, fenugreek, garlic, onion, and flaxseed. Whole grains, oatmeal, kidney beans, soy products, and fiber-rich foods help support better diabetic control. Antioxidant-rich fruits and vegetables help support overall health. A healthy diet, regular exercise, and proper diabetic control can significantly reduce the risk of diabetic complications. Remember these simple rules for healthy vision. Control blood sugar levels regularly, control blood pressure and cholesterol. Maintain a healthy weight and exercise regularly. Avoid smoking to protect your health. Follow a healthy diabetic diet and take medications as prescribed. Attend regular eye examinations and never ignore visual symptoms. Good diabetic control reduces risk, but it does not replace regular retinal screening. Diabetes can silently damage the retina, optic nerve, lens, and increase the risk of glaucoma. By the time symptoms appear, valuable vision may already be lost. A comprehensive diabetic eye examination should include dilated retinal evaluation, OCT Retina, OCT Optic Nerve Analysis, eye pressure measurement, fundus photography, visual field testing, and cataract assessment. If you have diabetes, don't wait for symptoms. Make eye examinations a routine part of your diabetic care. Early detection saves sight. Delayed treatment may not. Protect your vision.
Shri Venkateshwara Netralaya, Rajarajeshwari Nagara, Ramanagara, Kengeri, Bangalore.
For appointments, contact RR Nagara 93795 12374, Ramanagara 7019 412265, Kengeri 91483 16772. ಅಪಾಯಿಂಟ್ಮೆಂಟ್ಗಳಿಗಾಗಿ ದೂರವಾಣಿ ಸಂಖ್ಯೆ RR ನಗರ 9359123774, ರಾಮನಗರ 7019412265, ಕೆಂಗೇರಿ 9148383167772.